Hi everybody, my name is Gemma Delgaudio. I'm the Director of Marketing at Perfect Teeth, and I'm delivering another podcast for you guys. But today we're with another specialist, possibly one of my favorites. Don't tell anybody else. She is the newest member of our team. Her name is Dr. Tyler Mcgee. She is the new oral surgeon here in Colorado Springs, Colorado, and she's practicing at two of our locations. She's practicing at the South 8th location and also at the Union and Academy location. Let me tell you a little bit about her. She has a tremendous history in the dental field, and she'll tell you a little bit more about that in depth later on in the show. Let me tell you, first of all, she grew up in Virginia, and she received her undergraduate degree from the University of Virginia in biology. Then she went on to earn her Doctor of Dental Surgery, her DDS, at the University of Washington School of Dentistry in 2013. She lives very close to me, and we've spent the last 2 weeks together learning about each other, and let me tell you, she is absolutely fantastic. We're going to talk a little bit more about a day in the life of an oral surgeon later on in the show, but let's touch base first of all with Dr. Tyler Mcgee. Now, tell us a little bit about yourself and how did you get into the dental industry? Why not flying a plane? Why not, anything else in the world? Why dentistry?
Thank you, Gemma. When I was 4 years old, I received a Fisher-Price doctor's kit for Christmas. And ever since then, I was obsessed with being a doctor. I like the idea of fixing people. I like the idea of reconstructing broken bones or, plastic surgery. I was always kind of focused on trying to make a person whole again. And after I graduated from UVA, I moved out to Jackson Hole, Wyoming. And one of my friends happened to be leaving her position as an oral surgery assistant, and I took that job. Within about a month of being in that role, I fell in love with oral surgery. I love that we could take somebody out of pain from a bad tooth and improve their quality of life. We could reconstruct their jaws, their smile, identify any cancer and try to get them treatment immediately to help save their life. It was just such a profound profession, and I just loved it.
Wow, that's fantastic. Now, outside of work, tell us a little bit about what you have. We've spoken about the fact that you have a family. I can see here, and we've spoken about you like to snowboard. You like to do extreme sports, let me tell you. So I wanted to let the community know, what does a day in the life of an oral surgeon look like, from the time you wake up till the time you go home?
Well, my sweet darling 11-month-old baby typically wakes me up around 5:30 to 6:30 still. But I get to spend a little bit of time with her in the morning, feed her, and then let my husband take over from there. If I've been on call and I have patients in the hospital, I'll go round on them before work. Then I have a normal day doing surgeries and consults for patients. At the end of the day, I always like to call any of my surgical patients just to check up on them, make sure they're doing okay. And at that point, they've had kind of the trauma of coming to the dentist fade away, so they can focus on, oh shoot, I didn't pay attention to actually what you said for post-operative care. Let me ask these questions now. Then I go home to my wonderful daughter and husband and 2 black labs, and if I have time, we go on a bike ride or go for a walk or hike together, and then repeat it all over again.
I love that. So, from a young age, you've definitely been focused on caring and helping people. That's true. You've told us that. We've seen that in your care of our patients since you've started with Perfect Teeth. Now, even as we speak about your career, we've spoken very briefly at the beginning. You have to do additional training to be an oral surgeon. Now, what sort of timeline are we looking at overall of study time? And then what does it take to be an oral surgeon?
So after you have your 4 years of dental school, you apply for a residency program. And the residency programs can either be 4 years or 6 years. I chose a 6-year degree. Those 2 additional years, you earn your medical degree. So I'm an MD and a DDS. with those 4 years that you're focusing on the oral surgery, you study all about facial reconstruction, whether it's from trauma or cancer. We look at sleep apnea, which is a growing issue in this country with especially obesity. People have higher incidence of sleep apnea. So you could do splints for patients or jaw surgery to correct that, to get them off of a CPAP if they're not compliant with it or if they hate it. We look at the jaw joints, whether it's congenital, they're born with rheumatoid arthritis that affects their jaws or other diseases, or arthritis in older age that we have to reconstruct their jaws.
Wow.
We also, for the teenagers and and older people, but for overbites and underbites, we can reconstruct their jaws so their teeth fit correctly. It improves their aesthetics, also their chewing, and just their overall appearance as well. And then, of course, things like wisdom teeth and implants that most of the community's familiar with, but taking out, bad teeth and then reconstructing their smiles and jaws with dental implants.
Now, you certainly put the special in specialist, in my opinion. I've actually had my wisdom teeth out, needed for more room in my mouth. But why would somebody need oral surgery? If they do have their wisdom teeth, do they necessarily need them out? That's question number one. And then two, what age group do you serve?
Wisdom teeth, everybody always asks that question, whether they need them out or not, because most people don't have pain from their wisdom teeth. But the majority of people don't have room in their mouth for their wisdom teeth, and they become impacted or stuck in the bone. These teeth can put pressure on the teeth in front of it, your second molars. They can cause crowding or bone loss to the tooth in front of it, their second molars. Sometimes they have cysts around the wisdom teeth and need to be taken out for that reason. But it is a lot easier to take out a tooth and to have a surgery and to heal from it when you're younger, rather than, now you have pain and you're 50, 60, 70 years old. It's a lot more traumatic to have that surgery. So typically we do suggest having that prophylactic surgery of taking them out. Additionally, if you do have enough room in your mouth to have your wisdom teeth come in, and if they are well aligned so that you can bite, most people still, even if you're really good at cleaning your teeth, they're so far back there, you get plaque buildup and you get a cavity. It's really hard for a dentist to fill those cavities because they're so far back there. It's hard for them to isolate the tooth to make that filling. And then those fillings, you typically get another cavity. And so now you're paying all this money to have a tooth where you really just can't keep it clean. So even people who have room in it, most end up needing the teeth out at some point. And again, it's just an easier procedure, easier for you to heal when you're younger than, now 40, 50 years old and getting those cavities.
That's fantastic. Now, that's good information for us to learn, because we get the call all the time, I'm not in pain. Why do I need them out? So thank you so much for answering that. Now, in terms of age group, as the final question, do you see kids, or are we looking at just teenagers, adults? That would be the final question, I guess, for us today. But let's tell the community a little bit about that age group.
I see patients from newborns all the way up until 90-year-olds. Sometimes newborns have that tight, it's called a frenum. It's this tissue that attaches to their tongue, so it's kind of like tongue-tied. They can't nurse well, they can't feed. And later kids, if they have this, they can't stick out their tongues, they can't lick an ice cream cone, things like that. So we see kids as, early as the newborns, and then all the way up into the elderly. With our training, we focus a lot on the medical aspects of patients. And so as we get older and have all these comorbidities like hypertension and heart attacks and stents, a lot of people are on blood thinners. And have medical issues that we focus, and we know how when we take out a tooth, we can help the bleeding. And also just as a specialist, because this is what we do all day long, we're just very adept at taking out teeth. And so the procedure is a lot quicker for us than potentially a general dentist. And so it just allows the patient to be in the chair for maybe only 5 or 20 minutes versus longer. It allows the patient to have less trauma to the tissue. And overall, who wants to be in a chair for longer?
No one.
Nobody likes the dentist. So if we can get them out of there with only a couple minutes for a tooth, I think most people are much more appreciative than sitting in there for an hour. So It just allows us, as a specialist to help provide better care for our patients.
I love that. Now, definitely, I'll repeat myself, put in the special in specialist. Now, Dr. Tyler Mcgee, thank you so much for being here with us today. It's a true pleasure to have you on board with the Perfect Teeth family. Again, Dr. Tyler Mcgee is practicing at 2 locations in Colorado Springs. That's going to be the South 8th location and also Union and Academy. Please feel free to call if you would like a consultation or any treatment. We can typically get you in within 48 hours for your treatment. Thank you so much again, and we look forward to speaking to you soon.
Thank you.
Bye-bye.